is Morgan Lund. I'm a physical therapist here at Door County Medical Center. Today we're going to be reviewing your post-operative exercises as well as discussing icing and elevation after your total hip or total knee surgery. So let's start with the exercises. So you are all given a guidebook here for either your knee or your hip. It'll look just like this one. It has a lot of information in here regarding everything from icing to elevation to your exercises. So you can refer to this if you have any questions. So for exercises, this will be for both the knee and the hip. Let's start with just ankle pumps. So generally we have people start 5 to 10 reps. You'll do these exercises twice a day, and you can work your way all the way up to 20 reps. And more is not better, so pace yourself, start slowly. So with ankle pumps, you're just gonna be bringing your toes up and pointing down, and just doing that repetitively back and forth. You can do these with both legs as well. You don't just have to use your impacted surgical leg. So the next one is gonna be quad sets. So you're going to pretend like there's something underneath your knee, and you're gonna push the back of your knee down against the table. Now I'm doing this in a recliner here today. You can use your recliner chair at home or on your bed, but you should never do these on the floor. So push your knee down against the recliner or the bed, hold for about 3 to 5 seconds, and relax. So I'll just do a few of these here. You should mainly feel it kind of in the top of this quad muscle here in your leg, and then relax. The next one is going to be very similar. You're going to be squeezing your glute muscle or this buttock muscle. So squeeze the buttock muscle, hold for about 3 seconds, and relax. So the next one we're going to be doing is bringing the leg out to the side. So squeeze this muscle again, bring your leg out to the side and back together. So out to the side, just gently slide and bring it together. The last one, this is the only time you're allowed to put something underneath your knee. So you're gonna place something under your knee. You can use a pillow, a folded up towel, a large coffee can, anything that's under your knee. So same thing, push your knee down against that surface, squeeze up, hold for 3 seconds, and slowly lower down. So squeeze, hold, and slowly lower. So for those who had a total hip, those will be all of the exercises that you have to do. Now for knees, we add on a few extras. So sitting here, you put your foot just on a surface like this, just nice and flat. You're gonna bring your foot back as far as you can, slide, hold for a second or two, and then slowly relax it back out. This will just help you build that range of motion. So hold for a few seconds and bring it back out. Okay, so next we're gonna work on bringing the leg up. So squeeze the back of your knee against that surface, bring it up, keep your whole leg nice and straight, slowly lower down and relax. So squeeze down first, lift the whole leg up, slowly lower down. This one will be hard when you first start, but it'll come along as your quad strength increases. Now the next one is going to be sitting. You're going to be sitting in your chair, have your feet flat on the ground. You might want to move towards the edge of your chair just to give your leg plenty of room to move. But you're going to be pulling your heel back towards your butt again underneath the chair, holding for about 5 seconds, and then slowly bringing your foot back out just to work on building your range of motion. So bringing that heel back, holding, and relaxing back out. And those are all of your post-operative exercises that are located in your book. After surgery, ice is gonna be your best friend. So we want you to put ice on your joint for 20 minutes on, 20 minutes off throughout the day, especially after you complete your home exercise program, after a physical therapy session, or if you have increased pain or inflammation. So with the ice, we want you to always have a barrier between the ice and your skin. This can be a pillowcase, a towel, or simply your pant leg. So you can use the cryo cuff that you were given before going to the hospital. You'll be able to take that home with you as well and place frozen water bottles in that just to keep your joint nice and cold and to control that inflammation. Now you can also have an ice pack back on your hip. You can use a frozen bag of peas, or it can be an ice pack, anything that works for you. Don't feel at night that you have to keep ice on it. Get a good night of sleep and just ice throughout the day. Another good suggestion is to elevate. So now when you elevate at home, you can use pillows, you can use a stack of blankets, anything that allows your joint or your entire leg to be up above the level of your heart. So in this case, I have a couple pillows underneath my ankle to allow me to rest back so my leg is above the level of the heart. We never want you to put any pillows or a towel, anything underneath your knee to keep you in any degrees of flexion or any bending of your knee. If you keep pillows under here and you try to sleep at night, oftentimes it can decrease your range of motion and lead to increased stiffness in the knee. So always have those pillows or blanket underneath the ankle whenever you're elevating.